This is a demo of registering patients with the PaRIS Patient Registration and Information System. What we're going to do is go through as if we are one of the frontline volunteers registering patients. The frontline accounts have very limited access to the data, so they cannot just browse patient medical information. They can register the patients, do some simple searches to correct the demographic information, things like address, but they can't do much more than that. So that's the first level of volunteer that you might have doing this. So you might have 5 laptops set up to register patients, or 50. Some places are quite big and they have quite a few. Let's do a basic registration. You're going to click on register. You're going to put in their first name, their last name, and their date of birth. And what we're doing here is we're figuring out if the patient is already in the system for this particular clinic. You may have a clinic that lasts a week or 2 weeks or a day, and this is going to tell you if they're already in the system. If they are, you're just adding it for medical information for them. So we start off and they were not already in the system. If they are, it'll give you a little message and you'll click that yes, that's the patient. You're clicking which forms they have. Your system may not have all of these forms. Let's say they're doing dental and medical today. Then you're just going down answering the questions. I'm going to show you how you determine which questions get answered. And you could add and remove some of the basic questions like this. You can't add and remove, but you can just put in. And emergency contact information is, and their phone number is. Now go down to mailing address, put in something for the mailing address. And preferred language. This is an optional question. We're going to say Armenian, and employment status, unemployed. How did you hear about us? Social media. We're a veteran, and then you save. Now, what then happens is that you would print a label for the patient record. So you would just click this, and up would pop the form for the patient label, and you would click print. If you've got 2 patient forms, you would print 2 of these labels, usually on a Dymo printer, 450 printer, 400 printer. It's printed on a 30256 shipping label, and you would just print those and then close that. Come back here and on with the next patient. And then it's that fast to register patients. Now you do have control over the questions. So if you're an admin and you've logged in, the frontline volunteers can't do this, but as admin you could log in and control what questions are asked. So you could ask this language question, employment question, how did you hear, military question. You can also add your own questions. But let's just as an example, let's add the general health question, and we are going to put that. There's 4 sections of the patient registration page. You can put that in any of the 4 sections and determine the sort order. So what order do the questions happen? So we're going to say in healthcare history, we're going to put this general health question. It's going to be a drop down. It's predefined already, and we're going to add that. Now if we go in and register a new patient, we are going to see that general health question for this event. So let's start a new one. And we're going to start a new patient. And if we scroll down, we're going to see the general health status question now. and you can put that anywhere you want. So that's how you would add and remove. You could have, 100 questions if you want. That all slows down the registration. So usually if you're trying to get patients in the door and get their service quickly, the fewer questions the better. But you can add as many questions as you want to the system. And then if they're trying to find another frontline volunteer thing is that they can find volunteers by their name. So you just type in some of the name and you could bring up their record. Now I'm logged on as an admin here, so I can see a few more things, but that's how they would find it in order to answer some questions. Okay, that's registering a patient with the PaRIS system.